Hello folks, how are you? This is Dr. Arroyo speaking from My Health Consultants. You're walking down the street and you see somebody, you look at their eyes and there's something like a little bump on one of their eyes. And you've seen many times something like that because many of us, okay, raise your hand if you've never had a bump in your eyelid. It's very common. I remember I had one when I was about 12 years old and it was painful. Problem is that some people have a lot of them, and that's a problem because many times they don't go away. Those styes, what we call a Hodeolum, that's the medical term for it, that's what we see many times. Now these patients, they apply warm compresses, and you hope that applying warm compresses that will actually LipiFlow. And LipiFlow is sort of an X-ray or I'm sorry, not LipiFlow, but LipiScan. We'll talk at some point about LipiFlow in the future. But LipiScan is a technology that allows us to determine how those glands actually work. Those meibomian glands are a very important thing because the tears cannot be stable without the oils that the meibomian glands actually produce. So when those glands are obstructed and they chronically get obstructed, many patients, many people will have those elevations, those lesions that are either painful or not painful, but certainly very annoying. Now we just took an image of our patient and then chelation. See this gland here, what we're seeing is we flip the lid and we're looking at the meibomian glands. See this is the top lid of a particular patient where we see the glands being very patent, the structure, the anatomy of them is very normal, except for this area over here that we can see very clearly how it lost that patency of those glands. So that area, the whole area is obstructed, so those glands are basically not working at all. When that happens, then that's when these people have trouble. So about it, applying heat doesn't really work. So if you apply heat that doesn't work, what do? Well, at some point you're going to need some kind of injection, and the injection is basically steroid. You hope that that will shrink the lesion, and worst case scenario you need surgery. Well, we want to be better than that, and what we are seeing now is that if you apply a protocol where we use thermographs, these are glasses that have a membrane that is electronically controlled to emit the temperature. Is the right temperature for the eye, and that warms up the eyelids. Putting the right temperature helps for the eye glands to expand, to dilate, for the oils that are stagnant to sort of melt in a way so they can be reabsorbed faster. And then what we're seeing, this is very interesting, we're using technology. This is something called a biotransducer, is a pulse electromagnetic field emitter with red light, and this technology helps us because it enhances the ability of the cells to regenerate faster. And even most important, what it does is to improve the circulation, the blood flow. If you are able to increase the blood flow, what we are actually doing is allowing for those cells, for that system, for those glands to recover homeostasis or to go back to balance much faster. So if you have a stye, you have a Hodeolum, you've had it for a while, it doesn't go away, don't wait, because that treatment actually works very well for the first few days. The longer you wait, the harder it is to get results with it. But we are seeing a lot of accelerated great results with that particular technology, with that particular protocol. Again, if you have a stye, apply heat as much as you can at the beginning. Of course, don't burn your eyes. You can use certain oils like ozonated castor oils. There are some other essential oils that may work. Besides that, definitely you want to increase the amount of omega-3s, omega-6. You should get that plant-based mixed with the animal-based omega-3, omega-6 or essential fatty acid supplements that are different out there in the market. Get a good one. Take 2,000 milligrams a day. Besides that, If you get a lot of those and they tend to not go away, this is something that might help you. So you have questions, just drop us a message, put a comment right below this video, and we'll be very happy to try to help and lead you in the right direction. Thank you for being there. I hope you have a great day. We're closer to the weekend. We're excited about that as well. Thank you for being our friends, and I see you next time. Thank you very much. Bye-bye.